The Sustainment Training Center offers fully integrated collective training for brigade support medical companies and area support medical companies. Training is conducted during the unit's 2-week annual training and focuses on both individual skills for the combat medics and ancillary staff, as well as collective training at the company level. During a 2-week training program here at the STC, you will have the unique opportunity to work on individual skills during week 1. During the first week, 68 Whiskey combat medics will attend the Iowa National Guard Medical Simulation Training Center, co-located on Camp Dodge, for renewal of their National Registry of Emergency Medical Technician certification in accordance with TC 8-800. Ancillary staff, through a Memorandum of Understanding the STC has established with a local medical treatment facility, will be embedded with the civilian staff in their subsequent medical specialties. For instance, the lab tech will be with the lab, drawing blood and doing basic panels. The X-ray techs will work in different modalities through radiology and subsequent MOSs throughout the facility. Other select individuals, such as 68 Alphas and Juliets, will work in the STC medical training area with our instructors. 68 Juliets will have an opportunity to work in a fully stocked medical supply area. They will get to utilize the medical communications for combat casualty care, or MC4 systems, and DCAM, automated medical logistics system. During the second week of training, the unit will be tasked with configuring the medical treatment facility for Role 2 care. Based on the commander's intent and the unit level SOPs, the company will set up the medical treatment facility to best facilitate treatment and patient flow. All MTO items, to include medical equipment sets and Class 8 supplies for establishment of Role 1 and 2 health service support, is provided and pre-staged in containers located within the medical training area. The STC provides a unique opportunity often reserved for deploying units. Our facility has an intranet which connects the entire Role 2 facility, allowing you to input data, track patients, order labs, or any other diagnostic procedures and tests as needed. Patients entering the medical treatment facility will be entered into the MC4 system by the 68 Golf Patient Administration Specialist. The patient will then be taken into one of our emergency bays, where the medics and provider will initiate treatment. The STC will task your medical company with not only combat and trauma-related casualties, but also basic sick call illnesses and injuries. High-fidelity mannequins are set up to allow the providers and medical specialists to receive direct feedback based on their treatment given. If the incorrect treatment is given, the vital signs and patient status will reflect negatively. If the correct treatment is given, the high-fidelity mannequins will respond accordingly. The STC uses all organic equipment to a brigade support medical company or area support medical company. Vital signs monitors are available and can be connected to a live patient or high-fidelity mannequins. Large 60-inch monitors are used in the training environment to provide real-time feedback and help support our teach, coach, mentor methodology. Training aids such as the Tactical Combat Casualty Cut Suit are incorporated to enhance realism and training value. The TC3 Cut Suit is a wearable system that allows a patient actor to provide realistic feedback based on combat-related injuries. An exoskeleton with removable skin is worn and allows for various advanced level procedures such as chest tubes, chest needle decompressions, hemorrhage control, and more. The wearable blood pumping system increases the realistic effect with arterial leads in up to 4 separate locations throughout the system to include blast pants which replicate a high inguinal bleed and other traumatic type injuries. The radiology section has the ability to actually deliver ionizing radiation without harming a live casualty. This can be performed on the full-body phantom X-ray mannequin, which is anatomically correct to include bone and internal structures. It also allows the X-ray tech to position the mannequin as needed to capture and process images like they would in a real-world situation. Our fully functional laboratory challenges the lab technicians on tasks they would see in a real-world Role 2 facility. Some available training opportunities include the storage of whole blood, spinning down of samples, and microscopic evaluation to count blood cells. Our point-of-care iStat blood analyzer is available to draw lab based on the provider's intent and to help facilitate treatment. Lab techs also have the ability to perform other point-of-care testing such as rapid strep, rapid flu, urinalysis, and fecal occult blood tests. Training scenarios are pre-populated with appropriate lab data that corresponds with the presenting injury or illness. This allows lab techs to conduct real-world testing but give providers the information needed based on the scenario. STC staff will task the nurses and medics of the patient hold section on stabilization of the patients and housing them for up to 72 hours. At that time, they are either evacuated to a higher echelon of care or returned to duty. The patient holding facility has all the necessary organic equipment, including vital signs monitors, defibrillators, ventilators, and IV pumps. The STC also has a fully functional dental section, which includes the use of a dental training mannequin. This mannequin allows the dentist and dental tech to utilize the handheld X-ray machine for bite wings and other procedures. Our fiber optic dental depot is the newest technology the Army provides for World II medical treatment facilities. It is fully functional and has been used by past units in training to fulfill mandatory annual dental exam requirements and increase real-world unit readiness. Other dental equipment includes an operational field sink, sterilizer, and the ability to distill water for use in our dental depot. The preventive medicine section allows the environmental science officer and preventive med NCOs the ability to work within the facility on required tasks. They have the ability to provide support to the distribution company's water treatment platoon by conducting water analysis of various sources and ensure the purified water is potable. The PrevMed section can also conduct tests for various bugs or rodent infestations within the training areas. Additionally, they can conduct fogging operations if an area is deemed infested. Within the compound, the PrevMed section can also conduct checks on living conditions and work with the field feeding sections to verify food sources. Medical logisticians can work with the STC staff to become proficient with the DCAM automated supply system. They will train in a fully stocked medical supply area with all of the Class 8 expendable items that will be utilized during your training at the STC. Are you ready to get the best collective medical training the Army National Guard has to offer? Give us a call to schedule your unit today. 515-727-3522 or visit us online at www.stcia.com.